Welcome to the Kentucky Education and Labor Cabinet Office of Occupational Safety and Health online training resource. This course is presented as a service of the Division of Education and Training. Please read the following disclaimer. Welcome to the course, Bloodborne Pathogens, Understanding the Risks. This course is intended for employers within the Commonwealth of Kentucky that have employees that are likely to be exposed to blood and or potentially infectious bodily fluids. These workers may be first aid responders, janitorial staff, maintenance personnel, and personnel assigned to clean up following an industrial accident. After this session, it's recommended that participants obtain a copy of OSHA's Bloodborne Pathogens Regulation, found under Title 29 of the Code of Federal Regulations, Part 1910, Section 1030, and have it available for reference. Also, if your facility happens to be an HIV and hepatitis B research laboratory or production facility, it's recommended that you especially review paragraph E of the standard for additional requirements. Every job has its risks, but you as an employer or an employee can get to know these risks and deal with them safely. One of those risks is exposure to bloodborne pathogens like hepatitis B, hepatitis C, and HIV. Although it can be just as or more serious than any other hazard, you can prepare yourself to deal with it and work with it safely. This training module informs employees about how they can protect themselves against exposure to bloodborne pathogens in the workplace, explains what bloodborne pathogen diseases they can be exposed to on the job, how bloodborne pathogens are transmitted, how OSHA standards apply, and also outlines how to stay protected from exposure and what to do if exposed. Among all bloodborne diseases, the three most common found in the workplace are the human immunodeficiency virus, or HIV, the hepatitis B virus, HBV, and the hepatitis C virus, HCV. Some occupations have a higher risk of exposure to bloodborne pathogens than others, including all healthcare workers, housekeeping and janitorial workers, industrial first aid responders, research lab workers, and public safety workers such as firefighters and law enforcement personnel. The human immunodeficiency virus, or HIV, attacks a person's immune system and affects their ability to fight infection. Some infected people appear healthy for years, and some develop acquired immunodeficiency syndrome, better known as AIDS. AIDS destroys the human immune system so that it cannot fight off disease. Today, about 1.2 million people in the United States are affected with HIV. However, the number of HIV-infected people who develop serious illnesses and who die from AIDS is decreasing due to recent treatments. Still, there is currently no vaccine to prevent an HIV infection and no known cure. Hepatitis B, or HBV, is a viral infection that affects the liver. 94 to 98% of adults with normal immune status infected with hepatitis B recover and clear the infection. Yet up to 10% of those infected will develop chronic infections. If you become infected with hepatitis B, you may have no symptoms or feel like you have an intestinal flu, or feel so sick that you may need to be hospitalized. A vaccine is available to prevent the disease. However, unless you are effectively vaccinated, hepatitis B is a bigger threat to you than HIV because it's much more common. The virus can cause lifelong infection, cirrhosis or scarring of the liver, liver cancer, liver failure, and death. Each year, more than 1,500 people in the U.S. die from the chronic liver disease this virus can cause. Like hepatitis B, the hepatitis C virus, or HCV, also attacks the liver and is one of the primary culprits that necessitates liver transplants in the U.S. and is second only to alcohol-associated liver disease. Since they both have the same symptoms, a blood test is required to determine the difference. Most people that have hepatitis C don't even know it, but 55 to 85% of them will develop chronic infections. Each year, up to 4,000 people die from chronic liver diseases caused by HCV. While there is no vaccine for hepatitis C, the best way to prevent infection is to avoid the behaviors that can spread the disease. According to the CDC, getting tested for hepatitis C is important because treatments can cure most people with hepatitis C in 8 to 12 weeks. Today, about 1.2 million people in the United States are affected with HIV. About 850,000 people are chronically infected with the hepatitis B virus. Close to 2.4 million people are chronically infected with the hepatitis C virus. Remember, you can't tell who is infected just by looking at them. People can carry these viruses for many years while being completely unaware of it. Bloodborne pathogens are not only spread through contact with blood, but also through contact with other potentially infectious materials, or OPIM. Its definition is medically and thoroughly defined in the OSHA Regulation 1910.1030, paragraph B. However, this particular slide does list these materials in a general way and make them easier to understand and remember. In order for a transmission to occur, blood or other bodily fluids containing bloodborne pathogens must get inside someone's body and enter the bloodstream. These pathogens can enter the bloodstream through a break in the skin or through mucous membranes. Generally speaking, in our society, the most common ways these viruses are spread is through unprotected sex and needle sharing to inject illegal drugs. In the healthcare industry, where needle sticks are still a problem, there is more exposure risk to those employees. In workplace situations, you must know what you're up against and follow safe work practices and preventive policies and procedures. Following safe work practice and preventive policies and procedures do play a vital role in protecting employees with occupational exposure. Occupational exposure means reasonably anticipated skin, eye, mucous membrane, or parenteral contact with blood or other potentially infectious materials that may result from the performance of an employee's duties. OSHA requires employers to develop a written exposure control plan to explain how they will comply with the bloodborne pathogen standard, provide training to employees, and protect the health and safety of their workers. The Exposure Control Plan is a key document in assisting employers in implementing and ensuring compliance with the standard, and it must include the following: the determination of employee exposure, the implementation of various methods of exposure control, including universal precautions, engineering and work practice controls, personal protective equipment, and housekeeping. The plan must also include the hepatitis B vaccination, the post exposure evaluation and follow up, record keeping, and the procedures for evaluating circumstances surrounding exposure incidents. Also, it's important to note that the plan must be reviewed and updated at least annually to reflect changes in controls and work practices. The employer must solicit input from those non managerial employees who are potentially exposed to injuries from contaminated sharps. For more on the exposure control plan, it's recommended that you review paragraph C of the standard. The hepatitis B vaccine is a vaccine developed for the prevention of the hepatitis B virus infection. A course of 3 vaccine injections are given, with the second injection at least 1 month after the first dose, and the third injection given 6 months after the first dose. The process introduces and establishes an immune system antibody in the bloodstream. It is this antibody and immune system memory that provides immunity to the hepatitis B infection. A full response occurs within 95% of individuals. Individuals with lower responses may be required to receive a booster vaccination, a repeat course of 3 vaccinations, or further intradermal administration, depending on their retesting results. Protection has been shown for at least 30 years in those who showed an adequate initial response to the primary course of vaccinations. The employer must make available the hepatitis B vaccine and vaccination series to all employees who have received training and within 10 days of initial assignment where they have occupational exposure. They must be made available at no cost to the employee and at a reasonable time and place. Should the employee not wish to receive the series, the employer must assure that the employee sign the declination statement in Appendix A of the Bloodborne Pathogen Standard. More detailed information on these requirements can be found in paragraph F of 1910.1030. Should an exposure incident occur, the employer must immediately make available to the exposed employee a confidential medical evaluation and follow-up that is summarized on this particular slide. Post-exposure prophylaxis is a short course of HIV medicines taken very soon after possible exposure to HIV to prevent the virus from taking hold in your body. More information on these requirements and the information that must be provided to the healthcare professional can also be found in paragraph F of the standard. Employees covered by the standard must be provided bloodborne pathogens training on an annual basis and whenever changes are made to the exposure control plan. For new employees, they must be provided training at the time of initial assignment to test where occupational exposure may take place and annually thereafter. The training program must cover, at a minimum, the following elements: training on the epidemiology, symptoms, and transmission of bloodborne pathogen diseases, a copy and explanation of the bloodborne pathogen standard, an explanation of the site-specific exposure control plan and how to obtain a copy, an explanation of the methods to recognize tasks and other activities that may involve exposure to blood and other potentially infectious materials, including what constitutes an exposure incident, an explanation of the use and limitations of engineering controls, work practices, and PPE, an explanation of the types, uses, location, removal, handling, decontamination, and disposal of PPE, an explanation of the basis for PPE selection. Employees covered by the standard must be provided bloodborne pathogens training on an annual basis and whenever changes are made to the exposure control plan. For new employees, they must be provided training at the time of initial assignment to tasks where occupational exposure may take place and annually thereafter. The training program must cover, at a minimum, the following elements: training on the epidemiology, symptoms, and transmission of bloodborne pathogen diseases, a copy and explanation of the bloodborne pathogen standard, an explanation of the site-specific exposure control plan and how to obtain a copy, an explanation of the methods to recognize tasks and other activities that may involve exposure to blood and other potentially infectious materials, including what constitutes an exposure incident, an explanation of the use and limitations of engineering controls, work practices, and PPE, an explanation of the types, uses, location, removal, handling, decontamination, and disposal of PPE, an explanation of the basis for PPE selection. Other training elements include information on the hepatitis B vaccine, including information on its efficacy, safety, method of administration, the benefits of being vaccinated, and that the vaccine will be offered free of charge. Information on the appropriate actions to take and persons to contact in an emergency involving blood or other potentially infectious materials. An explanation of the procedure to follow if an exposure incident occurs, including the method of reporting the incident and the medical follow-up that will be made available. Information on the post-exposure evaluation and follow-up that the employer is required to provide for the employee following an exposure incident. An explanation of the signs and labels and/or color coding required by the standard and used in the facility, and an opportunity for interactive questions and answers with the person conducting the training session. The requirement for an employer to keep a Sharps injury log would apply to any employer who is required to maintain the OSHA 300 logs under the OSHA Regulation 1904, Section 8. The Sharps injury log is used for the recording of percutaneous injuries from contaminated Sharps. The Sharps injury log must be recorded and maintained in such a manner as to protect the confidentiality of the injured employee, and must be kept for at least 5 years. Even though the chance of getting a bloodborne disease in your workplace may be slim, you can further minimize your chances if you know what to do in certain situations. Take the time to discuss potential exposure risks that are present in your work area. In the following slides, you will see ways to minimize your risk of exposure to bloodborne pathogens. Treat all blood and bodily fluids as if they're infected, and assume that anyone could be a carrier. Cuts, sores, or even tiny breaks in the skin from dermatitis or acne can be doorways for the viruses to enter your body. Preventive housekeeping is another way to protect employees against contact with blood or other potentially infectious materials. It's very important to appropriately disinfect surfaces soiled with these substances, but be sure to avoid spraying any pooled blood or OPIM, as it could lead to exposure. Unlike HIV, the hepatitis B virus is very persistent and can survive on environmental surfaces, dried and at room temperatures, for at least 1 week. Although this slide does list some valuable housekeeping tips, it's strongly recommended that you familiarize yourself with the housekeeping elements found under paragraph D4 of the standard. Among these requirements is a general statement that reads, "The employer shall determine and implement an appropriate written schedule for the cleaning and method of decontamination based on the location within the facility, type of surface to be cleaned, type of soil present, and tasks or procedures being performed in the area. Immediately wash your hands and other parts of your body after you've made contact with any blood or bodily fluids, even if gloves or other barriers were used. Wash hands with soap and running water for at least 15 seconds and dry with disposable towels." For more information on hand washing requirements, review paragraphs D2 of the standard. OSHA refers to biological waste as regulated waste. and provides an extensive definition of this term under paragraph B of section 1030. In addition to following the steps presented on this slide, it's recommended that workers also consider the elements listed under paragraph D, section 4, Roman numeral 3, and paragraph G as well, because it addresses communication of hazards to employees. Paragraph G describes the proper way in which biological waste containers should be labeled or color-coded. For example, in lieu of using a label, an employer may choose to use a red bag or container for biological waste disposal. If workers also deal with contaminated laundry, they must handle it as little as possible, with a minimum of agitation, following the requirements listed under paragraph D4, Roman numeral 4 of the standard. A safe work environment is every worker's responsibility, and some safety measures are just plain good sense, like those listed on this slide. OSHA requires the use of engineering and work practice controls to eliminate or minimize employee exposure. Engineering controls isolate or remove the hazard from the workplace, and work practice controls alter the manner in which a task is performed in order to reduce exposure. Where occupational exposure remains, after institution of these controls, personal protective equipment must also be used. Paragraph D2 describes in detail how the standard applies to these and other required methods. Whether it's your primary or collateral duty to be a first aid responder, it's very important to remember to first protect yourself before focusing on the injured. When accidents happen on the job, it may seem natural to help your coworker without thinking about your own safety. Avoid letting blood, or OPIM, contact your skin, eyes, nose, mouth, and clothing by using protective barriers such as goggles, gloves, masks, and gowns. Paragraph D3 of the standard covers OSHA's requirements quite extensively in regards to personal protective equipment. Kentucky's KAR 803 2:320, Section 5, goes even further in regards to gloves. If an exposure occurs, don't panic. If you do get blood or bodily fluids on your skin, wash immediately with non-abrasive soap and water, and flush the eyes and any exposed membranes with water. If you get blood or bodily fluids on your protective clothing, remove it as soon as possible and place it in a sealed bag. Then wash your skin with non-abrasive soap and water, and follow your employer's policy to decontaminate or dispose of the contaminated items. Report exposure incidents immediately to your supervisor, and your employer can advise you about testing, counseling, and any other steps that are necessary once an exposure has occurred. Today, more than ever, workers worry about catching diseases such as HIV, hepatitis B, or hepatitis C. You could protect yourself from bloodborne diseases by using common sense and following some simple guidelines. If you know the risks and take precautions, you can be safe at work. Don't clean up blood or bodily fluids unless trained and authorized to do so. Know what to do before an occupational exposure incident occurs, and review your employer's exposure control plan. Remember, preparation means prevention. This concludes the course, Bloodborne Pathogens, Understanding the Risks. For more free online learning opportunities, please visit our website. And as always, thank you for taking this course.